Hello. Okay, so I have three. Hello, this is Channel Dad Bryon Lape, and I'm here to read some more articles. And I decided to do this as we'll do this way, just because I got three of them. Hopefully, in this, I flipped over to Chrome. Of course, I don't have an ad blocker for Chrome. For God only knows how much we're going to be able to read. But if not, I still have them over on Firefox. Well, I do have ad blockers, all kinds of other crap. I will put links to all three of these in the description. One of them is not so much the CDC as what states are reporting, but I was going to do three separate videos on. No, this is stupid. In fact, let's get rid of me and just do the whole thing. So the first one up now, some people are going to have a problem with where these are coming from, but you can find several of these on other websites as well. So some of these have got some commentary mixed in with them. So this comes from theBlaze.com. I think I saw all these posted on Twitter or something. I don't know. I don't have subscriptions in any of these websites. So, take that with a grain of salt. So Horowitz, the CDC confirms remarkably low coronavirus rate. Where's the media? Well, the media is not around because Daniel, their narrative is that it's all Trump's fault. Now, I like this one because he's got some hard data here and some charts. So people are likely to wind up, most people are more likely to wind up 6 feet under because of almost anything else under the sun other than COVID-19. And, I was very suspicious of all the claims back in mid-February. Many of my people that I worked with thought I was nuts. Facebook friends, there are people that have basically, I've had to drop friendships over this stupid ass virus. And so far, I have been shown to be correct or very close to correct based off the real data. I do not claim to know everything, and I just did some research, and I found all kinds of interesting things about this virus and the family of them, not just this particular, And I'm not going to go down all the rabbit holes of what all it might be, and whether it's lab created, whatever. There's a lot of other stuff that goes along with that, but. So the CDC just came out with it, but the CDC has been walking back stuff, and Fauci's been walking back, and that's kind of what I want to cover here a little bit of and get some latest information out. He just came out with a report that should be earth-shattering to the narrative of the political class. That it won't be. Yet it will go. Yet it will go into the thick pile of vital data and information about the virus that is not getting out to the public. Now, we'll see what happens with this video. I will get it up on BitChute as soon as I can, as well as on YouTube. I should start posting the mines again, and it'll automatically go over to the library once it's public. But this is information straight out of CDC, and I guess they're going against WHO right now. I don't know, the World Health Organization, but I've even had some things where I'm quoting people from the World Health Organization that does not go with the narrative, and it gets shadow banned. Haven't had anything taken down just yet, but we'll see what happens. For the first time, CDC has attempted to offer a real estimate of the overall death rate for COVID-19. And under its most likely scenario, the number is 0.26%. I still think that's a little bit high because I think we got a misreporting. But hey, till we have, huge number of people tested, it's probably going to hover around there. Officials estimate a 0.4 fatality rate among those who are symptomatic and project a 35% rate of asymptomatic cases among those infected, which drops the overall infection fatality to 0.226. So is this still nothing to sneeze at? This is not, hey, it's all made up. That is about twice of the seasonal flu, but we're not into massive hysteria numbers, right? We're not anywhere close to numbers of even 1969. And I've got another article that talks about something about the death rates. So this is scenario 1, 2, 3. Okay, so scenario versus current best estimate overall. I guess this is so that's the population 0.004. And what's interesting is someone was talking about Austria, and they tried to get into it. I did the math, and they were trying to blow me up. And I'm like, look, you can't even figure out how to multiply stuff. But they were at 0.009. So 9 people out of a million. So 0.009%. And then they did overall testing and required mass. I think the thing that they found is that people had it, that they didn't know had it. And then they ended up with an infection rate of 0.001%. So 1 in a million. So they reduced it by 9/10 basically. I think that the overall testing probably provided better. And because of the high I'm not going to suggest everybody go stabbing everybody with corona, but it does have a very, very high survivability rate. And I think it's definitely overblown. Till now, we have been ridiculed for thinking the death rate was that low, as opposed to 3.4% estimated of the World Health Organization, which helped drive the panic. And go down whatever conspiracy rabbit hole you want. I'm not going to go there. I don't contribute to just stupidity that you should contribute to or you would contribute to malice or whatever. But plus, ultimately, we find out that the IFR is even lower because numerous studies and hard counts of confined populations have shown a much higher percentage of asymptomatic cases. Simply adjusting for a 50% assumption asymptomatic rate would drop the fatality to 0.2. Exactly the fatality of John, the rate of fatality, Dr. John. I'm not okay. So here we have, I'm not sure who this person is, but hey, most importantly, as mentioned before, the overall death rate is meaningless because the numbers are so lopsided. Given that at least half of the deaths were in nursing homes, a back of the envelope estimate would show that the infection. So basically, what they're finding with this one, and maybe this is a bit more true than regular flu, is being in confined space is horrible. Now, nursing homes, everybody's wearing masks typically, at least amongst the staff, okay? And yet it's still getting spread around. So the mask is useless, and people have been saying that since February. And yes, if you're coughing, if you're hacking up phlegm, it'll keep it in there. But once you've done that, now you have to either clean or dispose of that mask. Okay. You don't just keep wearing it and then re-inhaling all that nonsense. So if you're an idiot coughing on people, hey, you can get, or sneezing on people, you should be punched, in public. But all the particles itself will go right through an N95 mask, okay? Because it's half the size of the smallest holes in that, and that's the stuff floating around, not the modules. You got a loogie. People say, "Oh yeah, but but if I cough, all that heavy stuff just goes to the ground, or it goes into my hand, or it goes into a tissue or whatever else. It doesn't just float in the air. The stuff that floats in the air goes right through the mask. Genius." The CDC estimates the death rate from COVID-19 for those under 50 is 1 in 5,000 for those with symptoms, which would be 1 in 2075 over 6725 overall. But again, almost all those who die have specific. Yeah. So that's the thing they're finding too, is in school children. Sweden did it right. I don't care. There's been things trying to debunk that, and they're just hit pieces. Sweden did a lockdown, folks. They did one that made sense. They did it targeted and exactly the way it should have been. So I'm going to read this whole article. This was more here than I thought. As you can see, even in Spain, the death rates from COVID-19 for younger are very low. Yep. Kids that are stayed in school. For infectious disease doctors in Canada estimate that the individual rate for under 65 is 6 per million. That's actually very, very close to what Austria has, and which is roughly equivalent to the risk of dying from a motor vehicle accident during the same time period. Yep. These numbers are for Canada, which did have fewer deaths per capita than the US. But the thing is that New York has so lopsided everything, with the governor putting all those people into nursing homes and letting it spread in a confined space. And that doesn't surprise me. So let me flip over to the next article quickly. So this is the CDC emitting. So that was some information from the CDC. And this again, now we're a coronavirus mortality ratio similar to 1957-58 flu when we had no pandemic. And this is some of the stuff I was thinking about. So we have some information, and I can't barely read it, and hopefully this won't go to, it is going to go to Twitter, but that's fine. It's a 50%. So basically a ratio IFR is 0.27%, almost the same as H2N2, which we don't have a vaccine for. I don't think H2N2, we might, because that feels like it's similar to swine flu we had a few years ago. Caused 1 to 2 million deaths worldwide, which I don't think we're quite to that level worldwide. The coronavirus has reportedly killed 97,184 Americans, if you want to believe the numbers, mostly seniors and those with comorbidities. Comorbidities. So basically, they've got some underlying. So yeah, I mean, you've got a highly compromised immune system fighting off something. or maybe you've had cancer and you've had chemo and you're barely hanging on. This thing's going to push you over the edge. I mean, a cold could do that. The seasonal flu has killed an estimated 24,000 to 62,000 Americans. It just depends. We've had effective rates for the seasonal flu vaccine as low as 16% recently too. So that's interesting. This is a very small one. So there we have it. The population, okay, or about half the current population. So, and worldwide, we probably had something similar to about half, because you're not in 57. You're only not quite a generation out of World War II. So there were a lot of people killed during World War II all over the world. And so that's that one. I'll put that in the Spectator. And then the other one is really confirming some of this stuff from the states themselves. And we got Fauci there with his arms crossed. He has been he's now flip-flopped. It's like he's become like a ping pong ball. He'll say something and then he'll flip-flop. I mean, he flip-flopped today on something that he said 2 days ago. And I'm like, dude, come on, and he's trying to backtrack. He's been trying to cover his tracks for a while. There's a lot of evidence that shows that this virus is straight out of research he did in the States before Obama shut it down, and then he moved it to China. And that's not me, that's CNN saying that. And in 2018, we had a very bad flu season and tens of thousands of people died all over the country. Most of you, including me, didn't even notice it happen. Yeah, I didn't either. But there are times, 2018, I didn't get, let's see, that's the year. Yeah, I got something really nasty in 2018. I had a fever for 3 days and was hallucinating in French. And when I finally got to my doctor, he called it a viral bronchitis. But and they did the thing up the nose and all that stuff, and I was negative for flu or what they were looking for and everything. And most of y'all didn't, including me. In fact, the media has barely covered the 2018 flu season. I didn't even mention, I think it was 18. Yeah, I don't know, 17 or 18. I don't remember. Because the media, as a result of the general public and the politicians, mostly ignored these deaths, probably because of all the deaths. Yeah. So that was during Trump. So that's kind of weird. And yet this year we completely abandoned all logic and reason, fell victim to fear porn. And a lot of it gets out of the Imperial College and the data model. The guy's been wrong. The professor of what's his nuts has been wrong for 15 years. Every model he's had has been multiple orders of magnitude wrong. It's not like he's been really close. It's 30, 40% off. No, we're talking 10 to 20 times wrong. After the third or fourth time, no one should have listened to him at all. I mean, but last week, CDC released coronavirus data on their website, which made it clear that if you are not under the age of 50, or that if you are and I am over the age of 50, you are in more danger of death from the yearly flu than from the coronavirus. And that is incredibly true. And I think that actually is probably the weirdest thing, is understanding why that's the case. Why should that be the case? The state of Pennsylvania, for instance, has seen more people with over 100 years old die than people under 45 years old. Wow. So that's interesting. I didn't know had that many people over 100 years old in Pennsylvania. So number of deaths, 70, under 45. Okay. Wow. A total under 45. But right in here is the unfortunate sweet spot. So when you get into the 50s, I mean, 83, 50, 54. So the 50s, you've got 230 something. But my goodness, you get into over 80, it really climbs. So now I'm guessing there's only 341 in the 95 to 99 because now was that percent of, I don't know what the percent means. Is that the percent of cases or that's 7.6% of the population that's in that range? I mean, if that's the case, that's a lot of, redo the math backwards and you can figure out how many people in Pennsylvania in that frame. That's awesome that there's that many people, if that's what that is. I want you to think about that for a moment. More people in Pennsylvania have died for over 100 years old than those under 45. Yeah. And I remember seeing, all kinds of stuff about people over 100 beating the living crap out of this thing. Said 4,300. So this is why I think other than also some false reporting, I think this is what's bumped the New York numbers up when Cuomo sent 4,300 Ellery hospitals patients sick into nursing homes. So he moved them out of the hospital for whatever reason, sent them to nursing homes, and then it went rampant through the nursing home. And that's why New York has got such real, and Newsom, my understanding, California did something similar. So New York and California have got these very skewed numbers, and it doesn't, and it makes the average higher. But when you do as an outlier across the country, it is amazing. It's like, what in the world's going on there? And even Democrat governors who didn't do things like this don't have death rates like they see in California and New York. New York this isn't just 4,300. So they basically just killed people in nursing homes. And I'm not going to say it's some part of some conspiracy. I think it's just out of stupidity and more than anything. So we don't need to learn all the specifics there, the verbiage there. So now we have fascinating thread here on JP Morgan lockdown study, which finds lockdowns ending aren't increasingly spreading a virus anywhere. That's true. Now, you guys still take it with a grain of salt because we are coming out of a flu season. It's finally warm where I live. And just in the last few days, it's now been over 80. But I mean, we had 45 degrees and rain for about a week, even in May. But sunshine, warm weather, getting outside, getting fresh air really, really helps. It doesn't survive long in the sunshine. And when you're sneezing, unless you're in an incredibly crowded, with a tightly packed crowd in an open space, that's not so much. But you're outside, the wind's blowing. When you sneeze, it'll take all those particles away. It is amazing how quickly it gets dispersed when there's a breeze. So again, confined spaces are part of the problem. So this is again where lockdowns can be have proven in the D.A. Henderson study that was published in 2006. It's part of what they found. This stuff just gets recirculated in a home or in an office space so working from home necessarily, and where I work, we actually have large open floors. So you might make someone around you sick, but you're not going to make someone across the room sick because it's just too far. And you think the decision for like those 7 state governors to send coronavirus patients back into nursing homes would be the number one story in America, since it's likely to cost tens of thousands of lives? Yep. But because, again, there's the political nonsense. I guarantee you, if that was a bunch of Republican governors, that's all you'd be hearing about, how they're killing grandma. And this would be literally true because they send them in there and that's what happened. Again, you look at the numbers. I know this is circular around. Ohio would not count. Ohio's kind of in the middle. We're not really open. We're not really closed. We're kind of in the middle. We're more of a purple state. And I expect Ohio's numbers to climb a little bit higher than like Florida and Texas. Well, it's already higher in Texas. Georgia's been seeing their numbers go down quite a bit. Ohio, we're just kind of stagnant, and mainly because we haven't opened up quickly enough. The right places. Data tells us truth is really 2 different diseases, one for people over 65. Yeah. And what's interesting, I heard an interview on the radio of a practicing doctor. I forget, it was California somewhere. I forget exactly where. And he described, it almost sounded like he was treating 10 different, he had like 30 patients and almost all of them had uniquely different symptoms. And he was having it, but they all tested positive for corona. So that could also be basically, depending on what else is already there in the patient, it may express differently, or it may incur different things on people. And I think that's what's been part of the problems trying to treat this. And we also learned that the ventilators were killing people, which makes sense if the hemoglobin connection turns out to be the case. Because when someone's iron is being pulled out of their hemoglobin, pumping more oxygen into them actually does not help. You've got to get their iron stabilized, which is what the hydrochloroquine actually helps do. Because some aspects of this do things similar to what malaria does, which is why that drug works. Which is what there's been lab tests on hydroxychloroquine on various coronaviruses since 2007. Just no clinical tests, and they all showed the hemoglobin connection. And it's possible lockdown really didn't change things in this country. Yeah, it didn't. I think Sweden's lockdown made a bit more sense. I think if Cuomo would have kept those elderly patients in the hospital and not send them, I think you would probably see in New York at least 10,000 fewer deaths. That's just my guess, my gut feel, based on the numbers of people that they moved around. And still, that's not huge. It's not like he's got 100,000 in his state alone. Then we have the mask nonsense, where the media wear it, but no one else does. This is, to me, is very similar to the times when they'll say there's a flood and it turns out they're standing in a hole, and the flood is really a few inches, but where the hole is, it's chest deep. We've seen some pictures of the cameraman and the sound people and everyone else standing around the reporter, and none of them have masks on. Obviously, the senator, the congressman, was the Virginia governor. There's been several governors that have done this, as well as shut everything down and then get their hair done or The Arizona governor, I forget what she did. She did something special for her husband, and it just broke the news today. And all animals are equal, just some animals are more equal than others. If you haven't read Animal Farm, I advise you to go get a copy. So there's some of the 3 latest things to come out in the last couple of days. I'm all for all of the information going out there, unfiltered. I'll let people make up their own minds. If the data doesn't it goes against your narrative, then it's time to change your narrative. And understand why you had that narrative. Did you have bad data? I mean, early on, I was like, okay, this thing looks like it could just, be bad, but not spread as easily. And then it was like, well, it's not as bad as they thought, but it spreads easier now. It's like, well, it doesn't spread as easily as we thought. And depending on the person, and that's part of the problem. Some people are asymptomatic for weeks, and other people get it, and it seems like they're horrible in 3 days. So who knows? But so there you go. I'll put links in the description below to all of these articles, and so you can peruse them yourself. You can lambaste whoever, you can cry wolf at the messenger, or you can look into it and make up your mind. All right, thank you very much, and we will see you. Goodbye.